Good afternoon. Today what we're going to be doing is a cellulite treatment using shockwave therapy, which is also going to be preceded by something called radiofrequency. So what I've done with this patient, she has very minimal cellulite, but she works out hardcore and she wants to be perfect. So what I've done here is I've demarcated an area of concern for this patient. There's very minor dimpling, however, we're going to address this concern. Why do women have cellulite while men typically don't? Well, the question lies below the dermis. So connective tissue forms cross bridges between the layers of the dermis. And in women, it's typically vertically oriented, while men, it's cross-hatched. Now, the fat deposits within these connective tissue bands, and it tends to migrate upwards in women, and you see some dimpling in the skin. So what we're going to do with this technology is it's ultrasound technology. It's acoustic sound waves. We're going to penetrate deep into the skin and help break up these connective tissue bands. I'm going to apply the applicator tip. We're using the ceramic tip here. Okay, and this machine sounds something like this. Okay, nice pulse. Ready? Okay, so I'm just going to apply a direct pressure. I'm going to do approximately 200 pulses per region. And if she can tolerate it, I'm going to do a little bit more energy. How's that, Maria? Okay?
Yeah.
Okay. For the first treatment, I'm just applying a direct pressure into the trouble zone in a zigzag pattern. And we're going to repeat this for about 1,000 pulses. There are some tender spots in the hamstring muscles, especially in athletes, but it's generally well tolerated by most patients. Okay, the next phase of the treatment is using the Viora V10. So what this does, it's a radiofrequency plus vacuum machine. Now the purpose of this for cellulite treatment is to address the fat cell size. So remember, we have the fat cells wedged between these collagenous vertical bands. Now we're going to address the fat cells itself, and we're going to stimulate it to shrink. So we're going to apply pulse here, and if you can see on this handheld device here, I have a temperature gauge, and I'm going to apply pulse in an area and just kind of glide up towards the lymphatic drainage. And as I go over that tissue again, the goal is to warm up the underlying tissue to about 42 degrees Celsius. Once I'm at 42 degrees, we're in treatment mode. This treatment takes approximately 15 to 20 minutes per region. So if we're doing 2 legs, we can get done in about half an hour.